This podcast is being brought to you by Osisa and Zaluso Arts in collaboration with artists to create COVID-19 awareness content. I am your host, Zara, and I hope you enjoy this podcast.
I feel like initially we had just blue-ticked COVID in general. Like, we were fine, we were chilling. But now it's at a point where it's spreading rapidly, but we're still not changing in any way. Nobody's taking it seriously. Even the authorities are saying one thing and then doing the other thing. And us as youth, we're just doing whatever we want either way. So I have a panel with me. I'm going to ask them a few questions, and then we're going to have a discussion on why, as a country, we're not taking COVID-19 seriously. And please introduce yourself.
All right, hi. My name is Lusayo Simwenga. I am a medical officer. I'm a doctor.
All right, hi. My name is Prince Wongani Chikweva. I'm an events organizer, artist manager, and a media consultant.
My name is Akulu Libenga. I'm a visual artist with Zaluso Arts.
And I'm Andrew Mihawa. I'm an events planner with Kabula Pamodzi, which is a hub there in Blantyre.
All right, and we have Callisto on the camera. Say hi.
Hi.
He's wearing his face mask. He's taking this whole thing very seriously. Okay, so I think before we get into my first question, I think I'm going to ask this to Prince. Have you organized any events since the pandemic outbreak?
No, the last event I had was in last year.
Last year.
Yeah,
is it because of COVID that you haven't organized an event or
Yep.
just other things?
Yeah, normally as an event organizer, you're looking at the economy as well.
Yeah.
So it's very rare you do an event in January, February. You're waiting for times to be a bit lighter in terms of economy, because in January it's apparently it's the month that a lot of us are paying school fees, but we don't have the money to pay for it. So for me, I usually plan my events from March going forward up until maybe December. And then in February, I think that was the time that we had a lot of activities coming in to do with COVID and restrictions. And yeah, when getting to time that we needed to do events, I couldn't do anything. So till now, we haven't done anything.
Okay.
How do you feel about, because there have been people trying to do events in Lilongwe. So there have been like car concerts where people come in their cars, and there have also been like online concerts.
Activities, yeah.
How do you feel about that stuff?
Well, for me, because this is, you don't want to learn on the job sometimes, you know. COVID has come with a lot of things that we don't really fully understand. And the first thing was, I needed to understand what are we dealing with. Because even if you try to do something, for example, it's doable to have an event. And we have had people doing events. They say, well, we have masks and whatnot. By then, we didn't have enough information. So for me, it was, let's get at a point where we have enough information, understand it better, then we can start talking about other things. To do events online, I thought that was another field I needed to learn, because I never had an event online. So I didn't want to get at a point where I'm doing something that I don't know, but because I'm forced to do. So right now, maybe I have more information about how to do an online event, because at the end of the day, this is my way of making money, and I need to find a way to balance the economics and say, okay, if I'm looking for money, are people going to buy it? Because now the value of whatever I want to do has to be quantified on online quantity. So it's different if you know you're going to a black show, you know what they will do. But if it's online, you don't really know what's going to happen. So I needed to also understand, okay, if I'm going to do an event online, how am I going to make sure that it really has the value that I'm supposed to have? Because the audience themselves, they're also learning about it. So I basically what I've been doing literally, obviously being forced to it, is learning and fully understanding what COVID is about, or if we're going to come up with solutions, what are we going to do about it? So definitely, I think that's what I can say, really.
And Andrew, I saw you attended an online festival?
Yes. I attended an online festival that was organized by one of my friends, Tammy. It was called the Kukaya Festival.
So you're at home just...
I was at home watching artists perform. It was strange.
Because the learning part.
Because for me, like, whenever you're having a festive experience, it's not just the music that matters. It's also the experience. seeing somebody fall off or seeing a friend that you haven't seen in a long time.
Yeah.
So missing all those nitty-gritties, because those are the ones that make the festive experience. Not having it in my sitting room, it was quite a different experience.
Were you by yourself?
Yeah, most of it, yeah, I was actually by myself. I was social distancing from everyone.
No, apparently you were with people that you were watching the show with, even if you're not together.
But I did not see them. But yeah, it was good. It was well curated. I think for an event that I think it was the first festival in Malawi that happened online, and so for kudos to the organizers.
How was the attendance?
I didn't know, like because first I think at some point maybe 29, 30 people, but then you don't know because people are viewing it maybe in multiples, so you might see that only 29 people are streaming it, but maybe they're streaming it in front of 50 people or 10 or something. So or maybe they're not even social distancing, there are 50 of them. And so it depends on that.
All right, so I think my next question is still on the same topic of events. When you see the words COVID-19 measures apply on a poster, a wedding poster, what else has been going on? Weddings, churches as well, just rallies,
an election.
So, when you see the words COVID-19 measures apply, does that make you feel safer, or you just don't care? I think let's ask the doctor first.
All right, so I've seen that a lot in the posters lately, especially the weddings, mostly the weddings, I think, because now it's that time of the year where everybody's getting married. Yeah, so to me, honestly, it makes no sense. It makes no sense because I've seen people that are wearing that have their masks on, and it's even those cloth masks. Yeah. The ones that we say they're not as effective, but we still encourage people to put them on. And within like 5 minutes, they take them off, and people are so crowded together,
because I haven't been to a wedding since COVID-19, but I was going to ask, like, how does the ceremony of Ufupa, how does that go? Like, is it one person at a time?
No, it doesn't work. I've been to a wedding. The last time I went to a wedding was June 27th. Yes, and they didn't say this on the poster that there would be COVID measures applying, but everybody just goes, like there was nothing, even no one was even mindful that this is a COVID season or whatever, and it was during that time when the numbers were just all over the place. It doesn't matter, people are just like in one place, and it wasn't even a garden thing, it was an indoor thing. Yeah, so
was there even like a restriction of the number of people?
No. People were just everywhere. Yeah, it was a proper Malawian wedding. Everybody was just there in one space.
So the funny part about when you mentioned about the restriction of numbers, like I said, for me is what we have not done as a country, is not to let ourselves to learn first. It's okay to say we really don't know what this is. Like, let's really learn before we even do anything. For me, I mean, some people might not agree with me, but I think even the messaging around the COVID has been really, 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 really misleading. There's
because
so many
they
things,
change, like especially with the mask,
because
they change
not
every
just
day.
the mask, but there's so many things. Look at the stuff we're talking about. Well, COVID is if you're older, you're at risk. If you are
Pre-existing
you have other
conditions.
conditions. That sounds to me, sorry to go back to the issue of HIV and AIDS. We used to communicate some things that were not really real because we were still learning, but we didn't want to allow ourselves to learn. Issues of circumcision. A lot of kids thought in a lot of villages, even now, a lot of not just villages, but even in town, people think when you are circumcised, you are literally immune to any other STI. You don't need to condomize and whatnot because of how that circumcision message were molded. Now, for me, it's the same thing about the COVID situation, where we're saying, no, if you have existing conditions, then if you don't have them, you'll be like, well, I'm fine.
I might as well just...
Well, if you're not older, you'll be like, well, I might not get it. let's restrict 100 people. I think in that restriction, it means the 100 don't have it. Unless
Because it makes
you
no
need
sense.
to test.
101
because
comes
even
in.
if you have but even if you have 100 people, all of you are infected, what's going to happen? Maybe
Or even
90
if there's
of
100 of you, and then
you're still going to
only
infect the
one.
10. Yeah, you just need one to
Yeah,
infect
and then
everyone.
you disperse
So for
and
me,
then
is
pass.
you can see that it starts from the fact that we haven't allowed ourselves to learn from what is it, and we have copied everything. The anxiety of the Eurocentric way of reacting to it, it's the same as we're putting it in here. Meaning, even the messaging is also. I mean, we can go on and on about the
But I
miscommunication.
would like to play devil's advocate in a way, because one thing that I was not happy about it, but also happy in a way, is that Malawians chose their own way of dealing with it. I know most countries went into total lockdown. Malawians said no way.
We were forced to it.
We were told to go into one. We blue ticked the other guy. We blue ticked the announcement because we knew the issues that are actually at the core of us. We know that there are more issues that would actually kill us more than the disease. Meaning that people also had an understanding of how this disease might affect us, but also having the knowledge of the environment that we live in and knowing the economics that we face as Malawians. And so, in a way, I was actually happy that we went on even with the Larrys. I know people were just putting the COVID restrictions for clout, but
Which
went on.
brings me to my next question. Does anyone even know what COVID-19 measures applies actually means? Like, in actuality?
Okay, the only place where this actually happens is in small settings, like very small settings. Because even if like a group of say health workers, if there was a time we had a lot of we had sit-ins at the hospital, if you guys remember. Yes, so almost all of us would get into one place and do all sorts of things.
And those were the doctors, huh?
Yeah.
Yes, everyone was there. Sorry to say, everyone was there. So there was no any measures applying because, even in that like smaller setting. But so to say, sorry to say, but even if these people say right on their posters that COVID measures going to apply, it doesn't make any sense, and it doesn't. Nothing happens. Nothing at all happens.
I think it just helps people feel
Safe.
I don't even know. I don't even know if
So-
people actually need that. People just
No, okay, because we do it because we there are people that we want to please. We're not really.
You don't want the police to come.
Yeah, it's like you saying, well, because you have a movie that you're doing to a theater, then you need to put what age restriction you put 18 years, 17 years, because you want to make sure that Kosoma and all these whatever bodies that are they need to.
you're staying by the book.
Exactly. But like I said, for me is the main thing is the fact that we haven't learned. Even the people that are, and the main thing, like I said, he talked about how Malawians say no, we need to do it the way that we sing it. But the challenge is that was one-sided as well. It was one side of rallies. At the time that rallies were happening, artists
Schools were closed.
Yes, schools were closed.
Schools were closed. And
Now you see, the people that are going to the rallies are parents to the kids who are not going to school.
Yeah.
What are we doing then? Some of them are even teachers, you know? So, like, for me is, we decided what should be happening and what should not. At the end of the day, here we are talking about this. You know?
Yeah.
So, for me, is the fact that we had Eurocentric reaction around everything about COVID. We forgot what we are. I'm not a doctor, but I believe we grew up and we are used to bacteria. Like, you would agree with me. We used to take a bath in the mud and whatnot. You still eat jaguja jadzuro, you know, and that's like with a lot of bacteria, but you still fine, you know. We're not saying that we have to be careless, but I'm just saying there's a way we need to do it as us.
And I think one thing I've been hearing a lot from people in terms of COVID-19 response was the schools. We shouldn't have closed them at the time that we did, because at that time we didn't have local transmissions at all. So we should have let the students finish with their semesters and then shut down now, because now it means they're going to be shut down indefinitely. like from the time they were shut down to now, and it's a very long period.
It
and
goes back to we didn't learn.
Yeah,
because
we just saw
how,
what people
how
were
was
doing.
the virus
And
moving?
also,
How
which-
was the virus moving?
which brings me to my second point. There were a lot of people that were just spreading panic, especially even in Malawi. When the government was, I think, maybe taking its time trying to decide how to go about it, there were people online saying, why are we not locking down? Why are you not doing ABCD? But then it's like, do you even know what goes into implementing this in a third world country compared to what's happening in the US?
For me, the panic comes with the fear of unknown as well.
Yeah.
So
Knowledge.
like when people don't know anything, you're hearing about it. It's killing people. You're hearing about how fast it's being transmitted. Of course, you're gonna be afraid. But then that also, I think worldwide, you can see that right now the way people were afraid of Corona in April, and now it's totally different.
Yeah.
Because the people that have actually had it and have healed from it, I'm like,
We know.
I've had worse in my life.
Yeah.
I feel like in Malawi, no one has literally ever been scared of it, to be very honest. And I don't know what it's going to take.
I was scared.
Oh,
Yeah, because we had the information about it.
Because it was, and just to like jump off of Andrew's point, where it's like you're afraid of something you don't know, and also the fact that you wake up every morning, you go to the news, just
Corona.
like 1 hour, and it's like
And it's always
the news is hectic. That's what's happening.
Yeah.
And then people are sharing all this nasty news online, and that's like every day. Every day there's new news, and it's like, this is horrible.
And
Yeah.
even what you're saying about like everybody was so afraid, everyone was basically we were afraid of the unknown. It was so obvious in the way people were asking their questions. Like every time you go on social media, you go on your WhatsApp, people are asking you all these questions. Is this true? Should I take this? Should I take that? Like people were stocking medications that they don't even need in their houses. I don't
People
know
are
what
stocking
Toilet
toilet
paper.
paper.
and now that we have a doctor here, like I'm just gonna say, are you guys ready for liver and kidney issues in May next year or
Because
January?
of the medicine.
Because the things
Because
we're
of this
taking,
WhatsApp group.
like these leaves that we don't even know
These
what they are
onions.
from.
It's like
these things,
a lot of aunties
Our-
have become herbalists in the house.
like But for me, it's like you're saying. For me, it's the time that we decided to do a national lockdown. If maybe that's just me, if we knew and understood how the virus is getting to you, is it's coming from China, right? It's going to another country, and then up until it has to reach Malawi, right?
Malawi.
Meaning, if you have to lock anything, you have to lock your borders.
The borders.
Yeah.
Like that's what I'm
Yeah.
saying, that we didn't have time to actually understand, because there are countries that they locked their borders way before anything, and they are fine. Really, their rates are really minimal. So for me, is we didn't understand, we didn't learn, we didn't give ourselves time and say, let's fully understand what is this doing. I know economically maybe it could have done something as well, but I think we could have survived way better.
But Prince,
Because at the end of the day, we had a lot of case studies, bro. If we were like one of the last,
we were the
countries,
last
Exactly.
yeah.
proper study.
See what was happening,
Like, I think
you know.
we should apply it.
And Singapore really did a lot of case study for us all. Like it really helped us because they locked their borders earlier than any other country.
But Malawi being the country that we are economically and
Yeah.
also being landlocked,
Yeah.
do you think that would be an option? Because one thing that I'm actually seeing, especially when it comes to dealing with the disease, is that there are laws of economics that are even happening. And even like most recently, we just had like the Gazette. So the things that don't really bring money, like school, churches, whatever, have been closed. But markets, the restrictions are opened,
Yeah.
and the numbers there are more higher than that. Even bars, like they're given even longer time. So like their responses to economically, and I'm not only pointing out to Malawi, but like as there was a video that recently circulated of airplanes
Yeah.
that are traveling, like
But-
Europe and Asia, everything is business
happening.
as normal,
Yeah.
but then Africa is being left behind.
Yeah.
So
But yeah, for me is, if we had to compare which one we need to lock down in terms of that, the economics of that as well, if we had to weigh the two, the borders or the national lockdown, I think the borders we could have like I know we need a fuel, I know we need all these things. I think those are essential goods. And all these countries that are locked down their borders, essential goods were still being
coming in.
allowed
Yeah.
because it's easier to control those. You can say,
It's
okay,
the
how many
people
trucks
that
do you
you're
have? Yeah,
posing.
but I'm talking about people that I had aunties and friends that we know they were still wanting to go to China in the time that the COVID was really hard there.
And they went.
Because
They
they
came back.
went. They came back. We had drivers, not just drivers, but people were going to South Africa. You know,
Tanzania.
The case in Chikwawa, you'd hear that, no, he went to pick up a car in Tanzania. Someone else knows she was coming from Tanzania, South Africa. For me is, yes, maybe if we had minimized, because that could have meant that we fully understand how it's getting here. Because we didn't have local transmission until we imported cases.
Yeah.
Either we wanted or we didn't want, but we allowed those to come here. So for me is, if we wanted to make any lockdown, I think the most realistic one was to close because that would have meant you really want to make sure that people are safe.
Not having it,
Yeah, but now we say no national lockdown, but the planes should be coming in, and then
The buses.
buses are coming in. But where is the virus coming from? It's
Yeah.
coming from outside. It really didn't make sense to me.
Yeah, which brings me to my next question. Since local transmissions are very rampant right now, we're not getting transmissions from outside of the border. Have you made any lifestyle changes?
Okay, I have. Like, I stay at home more.
It's because you work from home, Andrew. Come on.
Yeah, that helps as well. That helps as well. It's hard as well. Like, for instance, when you go out, I try to have my mask everywhere. Like, I have my mask right now, but it's down here because I'm drinking. so like the mask even infringes, like when you're eating and stuff, you
Yeah.
put it down. So yeah, but I'm more cautious about that. I think I wash my hands more than ever. More than ever.
usual, yeah.
I walk with sanitizer. I never used to walk with sanitizer.
Yeah.
I've had to make some lifestyle changes too. Like with my job, we can't work from home. We always have to go to the workplace.
Me too, events.
But when there is that, okay, those few hours that you get to stay at home, I make sure that I avoid visiting people, because I don't know what I'm carrying. I could be carrying something right now. I'm not. I hope.
Oh,
I'm not.
oh my God. Why did you say right?
And the other thing is, in the hospitals, sometimes you don't always have everything that you need. Like in case of protective equipment, you don't always have those.
Yeah.
But during this time around, we somehow make sure that you have something, even if the hospital is not providing you with those things. You may even make your own initiative to bring something to work.
Some scrubs and stuff.
Yes, yeah. So just to make sure, and I also avoid visiting my parents.
Oh.
How has that been? Like, that seems hard.
Yeah.
It's crazy.
Yeah, it is hard.
Do they live in Blanta as well?
Yes.
Oh,
You
shit.
don't want to kill them.
Yeah, because COVID and old people. Like,
Yeah, that's what they
Yeah,
say.
but-
Exactly, and this elderly population, it's affecting them more, as you already said. It's true, it's affecting them more. So you don't want to take something to them, something that maybe we could handle better if it came to us.
Yeah.
for me, I have, but at the same time, after months of not having any solution around it, I'm like, guys, really,
Let's move on.
like, you know, like I said, I'm not a doctor. I'm just a learner. Like, I'm really just learning and understand, because I think that's the best thing I can give to myself. You see, doctors, they're saying that a lot of kids are just carriers.
They
They're
don't
not
get
really
it.
sick. Yeah.
Yeah, okay, to be a carrier means, okay, fine. What you're saying is right. Yes,
Yeah.
it doesn't affect them
As it is to someone
to
else.
adults.
Same it
Yes.
goes to, we're testing people that are already showing signs.
Symptomatic. Yes.
Yeah.
So asymptomatic people
Yeah.
are being tested.
So
Yeah.
Yeah.
you see where now,
It's kind of weird to me.
yeah. So for me is, what is it that we're learning from there? Because for me is, allow people to do events. Then
Are
They'll-
you serious?
Really,
They don't
I-
show the symptoms. You test the temperature.
Yeah.
And whatnot.
Does that even actually
doesn't
work?
work.
I remember.
For me is the testing is just to, like we said, we want to show people that we are making sure that we
we're
are safe.
doing something.
But for me is if this virus is not going anywhere anytime soon.
It's
here.
not. It's
But
here.
For
I
me
think
is
that's one thing people
economically,
have to accept, yeah.
what we have done economically is to understand the numbers are 4,000 cases. Half of that have recovered. There's something we're doing right.
Over half now.
There's something we're doing right.
Stay at home.
Let's
for
not
14
get
days.
the Eurocentric way of reaction to the anxiety and nerves to us. It was projected that we'll be the worst hit by COVID.
All right, and people are so disappointed that
And
Africans
now,
were not
not
dying.
People are
even
mad.
millions.
People are
Upset.
mad.
So what I'm
Upset.
trying
Why
to
is
say,
Africa
I'm
not
Every
dying?
day on
and
TV.
this I should really say, it's not you saying it, it's just me as a person from what I'm understanding. We just need to find a way to move on. Find ways to just make sure
Just
that
live with it.
Like the way
Here's
we did
my
it
Like,
point.
for
like
election.
did you see online people the first social distancing festival
yeah.
where people were just like in clusters with
Yeah.
like barricades.
with the
Yeah.
friends?
But
looked fun
on
as
an
well.
event,
That was
for an event point of view, as an event
That's
organizer,
hard.
that's not just hard, that's expensive.
Yeah, that's what I was about
If I'm
to
going
say.
to do that event, you should understand you're going to charge more.
Yeah.
And the value of events in Malawi is not the way that others do it. Other people in Malawi, you go for an artist. You don't go for the event.
Yeah.
You decide who is there, and the artist has to do the things that you like, which is, hey, you're playing that song. If you don't, hey, get out.
That's why
Do you understand my point?
That's why people are mad at this international artist who just DJ'd instead
See?
of dancing around.
You see?
What is this Nyasa festival?
No. It was AK when he came. He was like,
I remember
Oh,
Prince,
yeah,
Prince KB.
in
He
the
does
long way,
all of
yeah,
those
yeah.
songs, and people
But
were not like.
that's what I'm trying to say. That if we have to, it's still the Eurocentric reaction towards COVID. We have to tell and make ourselves, guys, we really talented. Guys, if we sit down and say, well, it was projected we're going to be the worst hit, but we're not.
We're not.
And we said the mortality rate in Malawi might also be higher because of how we are careless. Guys, if you go to Limbi and tell someone and say, guys, there's COVID, they wouldn't believe you.
or just,
Because of how everyone is just doing their business.
or just
My point is,
like
if
a
you show
market
signs,
days. Yeah.
quarantine them. Check obviously who they're passed on. If they're not showing signs, I have a friend of mine who
But
had
that,
the
okay,
virus.
let me stop you right there.
Yeah.
I go to Limbi today. I come back tomorrow. I'm showing symptoms. So what? You're going to quarantine the whole of Limbi?
No. But if you can trust those people, I think we can.
Because I'm going to go to Limbi
or-
to down
Practical
Jika.
to
Yeah.
trace everyone.
You see how it is, meaning that we just
Contact
need
tracing
to.
is really high.
It's not
really
practical,
high.
but
So we just have to hope that we survive it.
Yeah,
But
like
okay,
I wanted to give an example.
Even if it was possible to do this contact, what are you going to do after that? Tell everybody to stay home, keep them in. What happens?
quarantine,
What's
For me-
supposed to happen?
Here's the-
okay, it's expensive. Even the quarantine thing, it's
yeah.
expensive.
And that's why you're sending
So-
people home, isn't it? So that they can self-isolate.
Yes, even the self-isolation thing is expensive because you are isolating people
That
that,
means
are
they're not
supposed to
doing
be
business.
productive.
Yeah.
Yeah, it's not easy because I remember there was this time when we were everybody we didn't know much about COVID, so we had to be trained. Well, if you are a contact to a patient or someone who has COVID, you have to go into quarantine, something like that. So quarantine was initially it was supposed to be for 2 weeks. So imagine there's a patient who comes and a nurse, a doctor, the clerk, whoever, they see that patient and then they are tested positive. So these 4 or 5 people have to go into quarantine or whatever because
That's
we're
2 weeks
telling
of no productivity.
yes,
Yeah.
that's 2 weeks. How,
So how
can
long
we
is it
afford
now?
that?
You said it was 2 weeks. Now how long
It
is
was
it?
supposed to be 2 weeks, but then now everybody
7 days, some are even just few days.
everybody is just working, and then you get to get the test if you're showing symptoms.
Yeah.
So if you're a contact, you continue working.
But okay, even if
okay.
you're showing symptoms, it's still, even if we test you, it's still just it's just for the records, right? Because at the end of the day, it's just okay, go stay home, right?
Yes.
So
Up
So
until
they
you recover.
isolate
yeah,
you.
so there's like even almost no point in testing.
No, but then,
I-
then if they test you, like for example, if they decide if I'm showing symptoms and they test me, they tell me to go home, then you've protected the population that I could have possibly transmitted the virus to, because I don't see people that are okay. I don't. I see people that are sick.
Because you are a doctor.
Yes,
Yeah.
I see people that are sick, and that's what I do. That's my job. So if someone is coming to me because they are sick, and then I have something, I have the virus, and then I transmit it to them, that means we have a
That's
double thing.
what I was about to ask you. In terms of PPE, what's happening in the hospitals now? Like, is every doctor like fully like equipped with PPE, whether they're in maternity or surgical?
Yes.
So every ward has the
Every ward.
full coverage and everything.
And
Yes,
then-
we
and then-
have
okay.
we have the basic PPE, the most basic PPE. We have that.
Which is
The face masks, the
you're
gloves.
using the disposable ones.
Yes.
Yeah?
Yeah. For good supplies.
Okay.
I
Yeah.
have to ask about gloves. I don't understand.
Yeah, and they don't work.
The gloves.
Are gloves really efficient? Is having a glove on more efficient than washing your hands?
I don't think for
'Cause-
us, but for doctors.
Oh, for us it is because you're
But
not
you already
just
wear gloves, like even before COVID. Like you're so.
okay, but then now because of this COVID, because sometimes okay, I have more experience with the government hospitals, so sometimes unfortunately sometimes we run out of water supply. So
Okay.
if you're not wearing gloves, and then maybe you don't even have like hand sanitizer or whatever, sometimes you may touch another patient before you wash your hands. Yeah, so there's risk of transmission, and you can even touch yourself elsewhere, and you risk transmitting to yourself. And those face masks are not 100% okay. They are effective, but sometimes they slip off your face. You have to fix them. If you haven't washed your hands, then that means you get the virus to yourself.
Okay. It just I have this. Sorry, I like I said, I want to learn more. So, on a medical point of view, will over sanitizing also be an issue at some point?
Why would you think so?
Like
just feels
generally,
a lot.
the body sometimes has bacteria that protects us from other infections, isn't it? So, if this tradition of over sanitizing, will that disturb? I know it's more medical, like biological, but I just don't understand because that's what I've been thinking.
You
to
think
myself.
it'll disturb the good bacteria?
Maybe.
Okay, you don't. Okay, pretty much everybody washes their hands. Like even before this COVID thing, you would wash your hands like maybe 4 or 5 times a day. You go to the bathroom, you wash your hands. So
Look at your face. Look at your face.
I used to.
doctor,
when I
that's
go to
you,
the
just
toilet,
you.
I wash my hands.
No,
but I
doctor.
didn't wash my
As
hands
far as the four
often.
of us and five, and
So you go to
people
the
there,
bathroom
maybe
about
just-
4 times a day.
Right now, if I'm coming
Easy.
from game, I'll sanitize. I'm entering ShopRite, I'll wash my hands. If I even go to PAPE, I'll wash my hands as well. I never used to do that.
And do you know my hands feel so weird now every time I go shopping because at every shop I have to wash my hands and they
Yeah.
feel so raw.
okay, fine. So
Chani.
Lotion.
it's not
But-
really something that we should worry about.
We shouldn't be worried.
We shouldn't be worried about it, even though there've been some rumors going around that it may increase the risks of skin cancers, but it has not been proved.
It's
So
skin cancer
it's
now.
not something that
Yeah,
we should
I mean,
be worried about.
these things are putting in
it's as
sanitizers.
good as
The soaps and
it's
whatnot.
as
So
good
this is
as
something we should worry about
disregarding.
later. Is that
No,
what you're
no,
saying?
we shouldn't
We
worry
shouldn't
about
worry.
it
At all.
because the active ingredient is alcohol, and I'm sure some of
Alcohol
us
is
here
Put it in your body day and
take
night.
it. I'm not saying that. I'm not saying that we should all take alcohol.
Yeah, but-
everything in moderation is okay.
Okay.
Yeah.
So in the hands,
Alright.
it's like well,
No, but you
It's-
see,
it's
that's
okay.
why I wanted to give an example of why I still think we need to get back to normal, like carry on. Is I have a friend of mine who had COVID, and he's a man, and his wife was also with him. Now all of them they had it. The man was really down for like a month. The lady just sneezed 2 days. She was fine, and she was pregnant. She still is pregnant. And literally 2 days, she didn't even lie down. It was like, and then she was fine. But the man,
No, that's the
in
point.
a month, yeah,
Because I could have COVID and you could have COVID,
yeah, and the reaction,
and we're about the same age.
yeah,
But the way that we're going to respond to it is
I
going to be
think
different.
that should have
That's
also been
why.
included in the PSAs initially. because people just thought Kuri old and people who have asthma.
That's what I'm saying,
and
that
things
they-
like
Okay,
There's a
that's
lot
the
of-
general thing.
Yeah.
The old people are going to be affected more. But even us younger people, we could vary.
Yeah, but that's what I'm saying, that the communication about it could have just been, it is dangerous to everyone.
to everyone. Yeah.
The specifics should be to the specifics,
yeah.
and say because you're older, you need to avoid this. But don't say it on a general public. and say,
But how do you now transmit that message to the
To-
elderly, to the
no, I think we have special, because you're looking at an advert that is like 1 minute on, let's say, on NBC, and the main thing is the older, the ones with these conditions should
They are
stay.
more at risk.
Yeah.
Yes.
Yeah, it is true. Like
Yes.
but the underlining message should be it is
Dangerous
it is
to-
dangerous to everyone.
Yeah.
Then we can go to the specifics to say.
Okay.
Also, if you're older, let's not. I don't know if you understand what I'm trying
yeah,
to say.
yeah.
The main message should have been. This
I think
virus.
in caps, everyone.
Yes.
It's dangerous to everyone.
Then we can talk about the specifics, because what has been
The
happening is,
specifics and-
if you meet young people, you understand how they're living. They're like, guys, we young, we fresh, we'll be fine, you know. Yet it's not true.
Yeah.
It is partially true, but it's
did
not
that come
fully
from?
true. So for me, is the reason why I would still want us to go back is because of that factor. It is for that factor, the fact that the reaction depends on the body, is different, and for us in Malawi, it's even worse. You get tested when you are showing signs. Meaning, guys, imagine
Not everyone,
living
yeah.
for the whole year, like for argument's sake, you not getting the virus for the whole year, but you have been home not doing anything productive. You haven't shown signs, you're not working, you're not doing anything. Forget about you being employed, but you're a business guy and you stop doing business because you're like, hey, I'm afraid to go on the market. Then the whole year, no
just
vaccine has
pass.
been out, and you're just staying, but you have never tested positive, you have never shown any signs.
That's sad.
That's what I'm trying to say. That there is that chance of a lot of people that can get it even, but they won't be showing signs. So, as a doctor, I think you will know if you have an older person and a younger person, you have to treat the younger person if you have to choose, isn't it?
Oh wow. Let's
Is
let's
it-
let's
Yeah, that's an effort.
Yeah,
Yes,
that's what
an
I mean.
effort,
That's what I mean.
but-
That we have to take the ethics in now and say, guys, do we have
Are
to?
you
get-
going to sacrifice your granddad?
He's
I mean,
literally
if I have to with my with his grandson,
You're his grandson. Are you going to
No.
talk to him? Say, granddad. At this point,
It's okay.
It's okay.
Don't take your medicine.
I'm taking your
if
Give
I
it to
if
the
I have,
little
yeah, I mean,
Would you do that?
he will be the ones to tell me actually to say, boy, get them. I've done my part. Like, you know, I think that's what I would do as well if I get it at that position.
Yeah, which brings us to the next segment of everyone doing their part. Has anyone here had flu since February?
Lots of it.
Yeah, I've had lots of it. June, July is flu season in Malawi.
Very nice.
Okay.
There's-
Every week.
Yeah.
So you've had the flu. You've had the flu. I've had the flu.
Yes.
We've had the flu.
I had
So
extreme flu.
have you gone outside of your house to do a non-essential activity? For instance, wait, I have a list of things here. Going out to drink, going out to eat at a restaurant, going to get your hair or nails done, just going to the barbers, just doing anything that was not essential. Meeting
I think
friends.
the barbers is quite essential.
It gets bad.
Even
It gets really bad. It gets
even
really
eating
bad.
out for people like me who stay in Chileka and I work almost every day in
Blind
town.
town. That's
I would have
essential.
to eat out for lunch.
But you know, like we're saying, these things could if you have the symptoms, it's better for you and for everyone if you stayed at home. And we're not even living by that example. It's like what is wrong, guys?
But to be
But
honest,
for me, I think it goes down to the way the messages is going. Because sometimes is it really practical? For instance, Prince stays in Chileka. Every single day he works in town. He cannot be driving back to Chileka to eat, or saying if he has a flu the whole month. Talked about productivity. Like if he stays the whole month at home without doing anything, that means he's not paying his rent. He'll be
Prince,
evicted.
how long did you have the flu for?
But it was a while. Actually, maybe 2 weeks even.
See, that could have been COVID. So do you think you could not
Yeah,
have stayed
but
at do you think you could not have stayed at
I
home
was
for 2
not
weeks?
showing enough signs to be tested.
So but
Yeah,
then
they said
the thing is
this is
even
just a flu.
even if you're not
They said I
tested, you
should-
should stay home, I think.
Yeah.
Yeah, that's why I'm saying that I carried on in my life, right? I know some people would call me.
Are you feeling any guilt? Do you feel any guilty?
I do, like really, because the government is making me feel like it. But
Government.
yeah, personally,
deep
what
down you-
what I did personally was to make sure that I keep on the hygiene, and I would tell people that guys, I have, you know, and then that was something that I had to make it known to them, even when I go.
But you
like-
know, like when you leave home, you're exchanging cash with people, you're like
But he has to
touching
live.
stuff.
He has to
Yeah,
get
that's
away.
why
Sure,
I'm
friends can
saying-
survive 2 weeks of not being productive.
no,
Can you?
No, I can't.
People in Malawi cannot
Oh
survive
no,
a
no!
day.
You have internet at your house and you have a computer. I'm
I
sure
need
you
money.
can survive. But then
I need money for that
But then it's
internet.
different from somebody who's selling tomatoes on the street every day.
No, not really. Okay, that's the difference. I think the only difference now is the magnitude of money that you need. It's not really that I don't need it as much as the person with the tomato needs it. It's just the fact that maybe the person with by selling tomatoes, she's looking at buying another bunch of tomatoes. I'm like, no, it's not just a tomato. Even the businesses, they need to be ran to make sure that they're making something to sustain themselves. Then you have other things that are following up. That's why, still, I'll go back to, let's carry on with our lives. Let's make our own way to carry on with our lives. Not a good example, but look at Tanzania.
And I
No,
just
but also look at
What happened
Malawi.
in
We had a
Tanzania?
whole election during that time, and like during the whole COVID pandemic,
Yeah.
we had a whole election
Yeah.
with Larrys that were full with numbers that I've never seen in my whole life,
Yeah,
and
So-
we still are here.
yeah.
The doctor had a hand up.
Yeah.
Okay, I'm thinking that if we tell people that okay, it's okay, carry on with your lives and whatnot, then everything's going to be out of control.
No. So that's where
Because
now.
for your case, yes, you work in town, you stay in Chileka, you have to eat out. There are always exceptions.
Yeah.
Because
He
even
eats out because he wants to.
yeah, even when they said that there's going to be a lockdown, they said Kuti, except for essential services,
yeah.
those people are going to be
be
allowed.
around, yeah.
Chanchani. Even if you're just staying at home and you have to go out to get food and whatnot, you'd still be allowed. People still go out and get food.
Yeah, but for me is, if we decide to do that, I don't think you're gonna say, well, guys, it's okay to do whatever you wanna do. No, I think it's us and saying, guys, we have this virus and we're with it. Let's make sure that we're minimizing the risk of having it. If you're showing signs, let's get home. Let's go to the hospital. Because
Prince, you're like contradicting your own
How?
point. You didn't stay at home when you had flu-like symptoms, and yet now you're saying, good, if you have the
no,
flu, stay at home.
I was told that the signs were not of COVID. I was not at a point where I could be tested. Apparently, I think doctor can agree with me.
But then the thing
'Cause it
is,
was-
I
for
don't
me,
think,
they
I
said
don't
that
think
it was
it's
just flu.
realistic to test everyone.
It's not.
Yeah.
And
So-
as a country,
You
we
see.
can't afford
So
to
Then that's a problem
That's
in
the problem.
itself.
That's what I'm saying.
That we can't test
One,
anyone.
we can't test.
Yeah, we can't
many
test
people,
everyone.
but we're letting them to stay at home.
But
So
also-
they have stopped. They have stopped doing everything that they could have made sure that they're surviving, even if
Also,
just for the
yeah.
luxury of moving.
Let's think about how, like, because this isn't the only example of something that, like, everybody knows this could lead to something bad, but we're still doing it. Think about, like, drinking and driving, unprotected sex. Like, there's campaigns on all these things, but there's always going to be, you always have that feeling that, not me. Like, I'm not going to be the one who's going to die. I'm not going to be the one
Exactly.
All right,
No,
yeah.
that's the thing now.
Yeah.
Because we could say people they go on with their lives. Someone gets affected. Okay, I get affected, and someone is gonna get it from me. I'm not going to be the one to die. Someone else
Yeah.
might die.
Yeah.
So
Can you live with that?
Yeah, and maybe I won't even know that I'm the one who contributed to
it,
their
yeah.
death.
Yeah.
I may not even know. So at the end of the day, I'm good to go with my life.
But I guess that's the sad part about life, because you don't really, like, you're texting and driving and you hit someone. It's not like you intended, you knew that I'm gonna hit.
But texting and
you know?
driving is illegal, right? right?
That's the risk as well.
That's the same
Don't
thing.
do
Where
it.
you
That's the
think,
same thing
where
that-
you think not me.
Not me.
I'm sure I can answer a quick.
Yeah. So what we're
text.
trying to say is that's how life is. Like this is like, unless you have it, you tested positive, but you still want to carry on with life
And you're
and
going
go.
into the crowd.
But if you don't know, because if you go to the hospital, they're not going to test you.
Yeah.
You have to show signs
But
first.
do you really think that people, when they get tested and they're positive, they're actually adhering to these measures?
But at
Because
There are
least,
some
but
that
at
are,
least,
there are
but
some
at
that
least,
are not.
doctor, but at
Like
A
I've
least,
lot,
instances
a
where
lot, a
Yeah.
lot.
Not.
yeah, but at
Because-
least you have the legal liberty to actually say no, you are tested positive. But for
Okay.
someone that you have not tested positive and to tell them that you can do this, I think, for me, is if the focus was, because now that's some point that if we focus all our efforts to say, okay, now instead of focusing on the everyone, let's focus on the ones that are positive. I think the work would be easier.
But you
even.
cannot identify all the people that are positive.
True.
If they
you
show
can-
signs, that is.
If
Not
they-
everyone.
But
But-
I could have a flu. It could be COVID or not.
Yeah.
And how many people do you are in a minibus? Some of
Right
us
now,
that
if you
use public
sneeze 3
transport.
times in a
You're in the
minibus,
minibus, and
everybody's
someone
there.
coughs
Everybody's
or they
there.
sneeze, and they don't even have a mask on. How many people are turning at this point to look at that person?
People do.
They used to. And it's not happening a lot these days. I've observed that. Like
Yeah.
now, people, we're not that conscious about it
So,
anymore.
so this thing of everyone wearing a mask in public, or else they face a fine, that is a good step in the right direction.
Yeah.
Right?
I actually
Yeah.
like that. I think it's something that we should actually do going
Yeah.
forward.
But
I love
then,
watching
And
it.
but
right
then,
now,
you know
even right
what's
now-
happened now? I think I was telling Mihawa that I couldn't go into Sana the other day because I didn't have a mask. I was gonna go grocery shopping, didn't get anything, and he told me that he wanted to go to a bank, and then he bought a mask that was not even up to standard.
Yeah.
And then now this is another problem because people will just be wearing masks that are not up to standard.
Because we haven't shifted the main
messaging.
focus to where we need to put it. Because right now we're trying to make it look like, well, when you stay home, we're waiting for a vaccine. That vaccine is not there.
It's not
What
even
we are
gonna come
doing right
anytime
now
soon.
is to prevent. We're not stopping it. So to prevent, guys, literally, it's not like you're gonna be 100% sure could we have done all we could have done. Meaning, because in that preventive measure, we are not even testing many people. So the best is enforce the preventative measures. I know one of them is to say, let's minimize people's access to things, being together and whatnot. Let's try and do that. Let's get the numbers right. If you're going to do a show, okay, what do you need to do? Make sure it's not more than 100 people. Make sure everyone is in a mask. Make sure everyone is washing their hands. You check their temperatures. Are we cool? Yes.
So who is going to be enforcing that?
Who is enforcing the masks? Who is gazetting the laws?
Because
Who
the
is?
thing
That's a
is,
very
Yeah.
good question. Are the police like?
Yeah, who is gazetting? And no, but the constitution is
Because-
quite clear.
because-
Who enforces the laws?
But
Yeah,
the thing is, the law has been gazetted, and we had a very wonderful ceremony where the ministers, the people within the committee spoke,
Yeah.
and then 2 days later, not to be a person, the person who is actually head of everything went to a funeral that broke
That's
all
why
those
I'm saying.
rules.
That's
Yeah.
what I'm
So
saying.
it's like
The
how we're not
focus-
even led.
No, the focus is at the wrong angle. We are not. We are literally going where we shouldn't be going. We should be going at, because the idea of us gazetting the laws is not to stop it, is to prevent it. Now, in that preventing, you should understand that there'll be people that are like, okay, in that preventing, are you really realistically doing this to prevent, or you're stopping at something else? In that preventing, you should have something that is tailor-made, makes sense for the audiences. What happened 2 days ago or a day ago, it is what we're saying, that it's not realistic. We are not looking at what we have. We are looking at the Eurocentric way
But they
of-
should have at least made some sort of effort, at least masks
No,
or,
but-
or something. But it was just everything.
okay, I think the policies are going to be
context
there,
for the podcast.
but someone is still going to break them.
might have to
How
explain
realistic is it that there are going to be 100 people
I
at
don't
a
wanna get
show,
political.
and all of them are going to be wearing face masks?
I'll give you an example of if you're going to do a festival, one of the guidelines is you have to have first aid kit and first aid attendants. The police, and I know, the city council and all the other guys, they make sure you do. And because that's where they get actually something from if you're not doing it. my point is, we've been able to do that in other circumstances.
Yeah.
If we have a situation here, and we have to be realistic in our reaction and say, okay, right now we have gazetted laws that if you're going to do an event, make sure there are not more than 100 people. Then there has to be someone. Reserve Bank said you can be putting money, perigan in the way that you should be doing. You know what they were doing? They were coming at the event, and they were even arresting other people that they were not adhering to this. Meaning, it's possible. Why are we not doing the same in the reaction to this? I feel like we're just copying something that is not realistic to us, and we're pasting it on the wrong page.
And doctor, I was going to ask you, I think a couple of months ago, I had like the worst flu, but then the flu symptoms were very like minimal, but I couldn't taste anything or smell anything.
Wow.
And then, yeah, it was bad.
Sounds like COVID.
Yeah. It was bad. But then, you know, like I have something just against the COVID-19 testing, because why should I have something stuck into my nose all the way to my brain? Like, that's just inhumane. Like, I feel like the person who came up with that is just sadistic, to be very honest. Like, honestly. So, I decided that I was at home for a couple of weeks because I'm already working from home and everything. But I ended up going to a shop, and they pointed the thermometer gun at me, at my face, and my temperature was good enough. It was 36, right?
That's the normal.
Yeah, it was 36.
So
I
So
think those
for me,
temperatures are
it
the
felt
biggest
like
liars.
I'm showing the COVID-19 symptoms. Because mind you, I didn't have much of a sore throat or sneezing and everything. I was just very tired. I had fever, no taste, no smell. But my temperature was apparently fine. So it's like, how sure are we about the thermometers?
Okay.
The temperature thermometers.
Every equipment has its faults. Yeah. So it's possible that sometimes you get your temperature checked and it shows you something that's within the range, and it may not be right. But it all goes down to our capacity to test everyone who's showing symptoms. We ideally have to be testing everyone, even those that are just contacts to a patient and they don't even have symptoms. We're supposed to be testing those people. But then it's about our capacity. Because yes, you may have had the flu, the loss of taste, loss of smell, but I'm not saying that. Okay, I'm not sure if you went to a health facility and they actually sent you back that they can't.
No, because in my understanding, I feel like it's better to have them come to me than for me to go to a hospital.
Yes. That's what has been communicated. That's what we've been trying to communicate. But yes, the whole thing is that we cannot manage to test everyone because of our capacity. Sometimes we're even running out of test kits ourselves, and it's really a fault on our side. It is, but it's a system
For not
thing.
stocking up, or
It's a system thing. That's what I'm saying. It's a system thing.
okay.
Yeah, because it's not something that someone is just keeping them for their own family somewhere. No, we don't have the things. We don't have them. So I think the best thing to do is just the preventive measures that we've been trying to preach that haven't been working so well.
Let me stop you there. Now we're going to talk about COVID and religion. Every time there is something major happening, whether it's the end of a millennia or a pandemic, fanatics come out and say it's end of times. And now the pastors are refusing. They've come up with a coalition or something, a group, to say that we're going against this 10 people in a church. We're going to be filling up to 100 or over. Like, how do you, if you're religious, how do you reconcile like your pastor's stance on this matter and your belief?
Double standards.
How?
Double standards. Me as an event organizer, when I said, guys, I can't survive, they never wanted to hear me, right? But because we have a social, religious conscience that makes sense if a pastor who you believe in, is telling you that no, 10 people, no, yeah. If I had to be like the first sentence he mentioned about the devil's advocate, I would start saying, well, why not just pray for it and this COVID can disappear? But that would be very insensitive for me to actually say. But they're allowing us to be in that conversation,
which is very true, because pastors have all these people come to a church and they heal them, people in wheelchairs, people with all kinds of diseases. But now suddenly,
we have
no one
no one saw
they are
COVID.
you see,
Rising
the
people from
government,
the dead.
the government and its institutions are telling event organizers, artists to do shows online and whatnot. Why are they not telling pastors to do the
Yeah,
same?
they've
But
told them the
because-
same thing.
And you know,
these
every
people are refusing.
time, it's not just Malawi, but everywhere, the clergy is so feared by governments for some reason. Maybe it's a historical issue about how governments
so, man.
existed from the clergy.
Yeah, from the clergy.
Yeah, but we are in 2020, guys. If
Yeah.
you and equal rights are real issues now.
Yeah.
You know? So
Yeah,
if
yeah.
you're gonna say 10
got
people,
colours and
10
stuff.
people, we can accept 10 people in church. Well, I'm gonna not accept as well in my bar. I'm gonna make sure that my event has people as well. I'm gonna make sure my business as well. Because that's why I'm saying that. Imagine if they said, okay, you can still have 100 people at your church, right? But make sure you have sanitizer. Make sure you have masks. Make sure there's social distancing. Make sure you do this. If someone is showing signs, they don't need to come to church. Yeah, that would start making us look like we're really heading somewhere. You know?
Okay, so I'll just jump in. Like, I missed church. Like, our church is one of the churches that closed.
Yeah, man.
And so I missed church for a long time. I was like, you know what? Forget this stuff. You guys are doing rallies. I'll go to a church that was still meeting. I went to this church, and for the first time, I actually saw what was happening. So, like, they have specific numbers. Chairs are properly spaced. Everybody who walks in, before they walk in, they have hand sanitizer, and then they walk in. They're tested their temperature. If their temperature is high, they're sent back. And so everybody who is let in has had sanitizer and has been temperature checked. But before they check in, they also disinfect the whole room. So they have like sprayers and stuff like that. So I saw that and I was like, okay, this is probably safe and we can check in. So I think everything, especially when we're dealing with this, I don't like the all size fits all. I like it to be something that should be customized based on different things.
Exactly.
What happened to that church gathering where I went? I don't think it can happen the same way in a village, because I don't think they can afford all that
stay-
stuff.
And first of all, I should just say that, do we even have the economy to be online for everything? Because already we're going through data mass for with honestly, can you afford to watch a live stream, like the whole live stream of a church service or your favorite artist?
I think
First
church
of-
Yeah.
service, see, they're usually on Facebook. I think it's usually like really low res. So I think it doesn't.
You can
cost
change the resolution. I didn't
Yeah.
know that. I used to watch the rallies on Facebook and like on 360,
1080.
1080 until like someone like changed them to me to like 144. So at least
Yeah,
I
but-
can hear what's going on.
But then that ruins the experience.
But
Yeah.
the challenge is not really we need to go to the numbers.
Yes, the access.
How many people
are
can
gonna-
access
Like
the
in
internet?
Malawi, in
Let's
Malawi-
start there.
In
In
Malawi,
we are still less than million.
people that actually have electricity alone
Yeah.
at about
Yeah.
10%.
Yeah.
So people that
wow.
have internet,
Wow, 10% of 18
of the-
million.
yeah,
Of the
of the-
population.
Even
God.
the people that I think
How many have running water? This is so.
it's crazy.
So
Sad
if we're going it
For
down
internet,
to internet,
for internet, this is why
low numbers.
a lot of artists can literally just push each other around maybe 50,000, 70,000 because active people online for Facebook, for example, they are less than 700,000.
Are you serious?
Yes.
But Facebook
Macra
has Facebook has the highest numbers in Malawi.
Yes.
But it's
It's-
less
it's
than
almost
less than-
700,000.
No, I used to think it's over a
No.
million.
No.
it's not.
Oh my
Active
God.
numbers.
People that actually have
Some people-
cell
phones.
cell phones.
Oh, so other
in
people just
Malawi.
log in on other people's phones, but they have the Facebook account.
You can log
Or
in at
maybe they're
work.
not as active.
Oh.
They're not active.
Yeah.
Oh, shame.
So that's why you still have lower numbers. And you see, this is one of the fun things.
my
I
God.
laughed the other day. I laughed. And the highest I think was Chilima, who had like, when they're doing those interviews,
push
they would
it.
have
Oh,
2,000,
2,000,
and
yeah.
people would celebrate.
Wow, 2,000 views.
Yeah.
Do you know the biggest media station on Facebook is Zodiac,
Zodiac,
with
yeah.
500,000. 500,000. These guys, they
And it's
they
not
are,
only
they are live.
Malawis in
They're diaspora, and actually a lot of them are in diaspora because that's the only way to access home news.
Zodiac, yeah.
So you should understand that you have that as a starting base. How many people can read it there? And if you get to that 700,000, let's put it at 1 million. remove the people that are active. You only have 700. Then you should remove people that are doing office internet. They're only visible
Because
Monday to Friday.
they're
when
working
at
from
work.
home.
8 to 5.
8 to 5. Then you're going to maybe 500. Then remove people that are on free mode. You go to 200.
On free mode, you cannot
Watch
watch live.
anything.
live.
You
Oh
cannot
my
see
God.
anything. So you have an account. You are visible in that statistics, but you're not active.
And secondly, that brings me to this point. I heard you and Akulu having a conversation about trying to convince churches and leaders, the elderly especially, to come over to the digital side. Of course, we're saying that there isn't much value right now. As we're saying, the numbers are very low, like even on Facebook and everything. But we need to do it now because there's no other way. We've been left with no choice. Has it been easier for you to convince them to, say, open your Facebook page for your church and do a live stream of your sermon?
It's never easy. You, like Mihao had put out that at some point these online platforms like social media, for example, Facebook, WhatsApp, if you spoke to it with your parents, they'll be like, these are demonic things. You get demons from this, you know. These are, satanic stuff,
Of course.
because they didn't understand the value that's in there.
Yeah.
What it meant to be on Facebook, what it meant to be on instant messaging like WhatsApp and Telegram and all these other things. Even companies, if you go to a company and say, guys, as a company as big as we are, we have to have a
page.
social media page. They didn't understand. They said, no, these are just for young kids. and
Because
whatnot.
that's the thing for me. Like I search everything online before I even attempt to go anywhere. Because online you can find the time they're open, the time they close.
Yeah.
And all the information you need to know before you go there, because it saves you so much.
Yes.
To just not go there
So
to ask these questions.
So the transition of that visual reality to the reality on the ground has been hard. But we've been forced to it. Now, at the time that we've been forced to it, we had not made any investment. So it will look like it's really not having any effect on our business, because
now you're starting from
churches are like,
scratch.
we have opened a Facebook page where we're only streaming to 3 people. What are we
If
doing?
you had
No,
opened
you
this
had
in
not
2018,
invested. You understand?
this would not have been the case.
All the churches that invested earlier on, they were streaming already, or maybe they had a YouTube page. They're not having it as
They're not
hard as
having
it is.
problems, yeah.
If they already started small groups on WhatsApp, they communicate on WhatsApp, they're not having issues like they used to. There were churches that when they do a sermon, they would send it to their
WhatsApp group.
people, so that they can read them. If they didn't come to church, they can watch them later on. They're doing that tradition, and this is not new.
Yeah.
They didn't even struggle.
It just
Even
continue.
issues to do with tithe, what do you call it? Church offering. Some
Yes.
churches had already digitized their platforms long time
Yeah.
ago, and they said, well, you can pay through our church account, and they were doing that. It's not an issue now. But one of the reasons why even the church is saying, hey, we need more people to the church, because they want that.
They want the offer.
But imagine
churches don't
the
even
same
admit
people,
it,
the same
but
people
that's
could
the
have
thing.
donated online.
Yeah.
These are the same people that are buying airtime on airtime. On Airtel money.
Yeah.
They're buying on
On
Bamba.
Emo.
They're Emo. But because it's church, they have not been told that you can actually do your offering on.
Fine.
So we haven't done that investment.
All right, guys. Does anyone else have anything else to add?
Yeah, just one last thing. Yeah, I know that the opening line was COVID,
Yeah.
so now we went
It's going to
talk
you.
about
So many
I
things.
think the
Yes,
creatives
a lot
have
of
jumped in.
things. Yeah. and quite frankly, I've learned a lot of things from this interaction.
Yeah.
But I can only talk about what I know. So driving it back to this COVID thing, I think maybe we should admit that our focus has been wrong. Yes, our focus has been wrong. We've been looking at this public health perspective. So we want to protect the masses, but we're not doing it right. So maybe if there was a way that maybe those people that are in power, the policymakers, are able to engage more people into their platform so that they should make some concrete suggestions, I think we could be making much more strides than we are currently, because I'm sure that this is pulling everybody back. It's the economy. I'm sure it's not going right now. most people are broke. So
course.
if we are broke, well, obviously the country is not doing well.
Yeah.
So I think, yes, our focus has to change. Our focus has to include all these important people. Yes, because brilliant ideas, I do nothing about.
But also, just to add on what you're saying, wouldn't want to be a decision maker within this situation, because the reality is the solutions that are going to be made, that's not like just, I'll say, one size fits all. They have to be tailor-made to everyone. And
Yes.
if you're saying everyone in Malawi, that means you're including 18,000 people. 18 million people. And so like there was this thing about enforcing masks. I was very happy about it. Like for me, masks are very important, but then there are people who are deaf. And then they're saying,
And we had that conversation about it.
How
How
am I gonna understand people
what I'm
if
saying?
they have masks on,
mask
because
on.
I rely on reading their lips.
Yeah.
And so we want to be inclusive and not
should
leave
keep that in mind,
everyone
of course.
behind. But then if you're coming up with those solutions, you know how important a mask is. But then you don't also want to leave somebody behind. So there's so many issues that come into play, and so I wish them well.
That's why in that tailor making, you say, okay, we have these groupings in the hospital. Let's start in the hospital. You guys are prone to this because you'll be meeting, let's put the necessary focus. Let's make sure that they get the right equipment they need. Okay, in events, you guys, the least we can do is 100 people, but make sure you're doing this. Then you go to another institution, because as a country, we can't just have the same. Every individual has to have what is working in the markets. How do you make sure? Because you see, in the super malls, right? This is the funny part. You see where the focus is really funny. In the markets, it's mandatory for them to have sanitizers, what to make sure.
Like local markets.
They're even giving out free masks.
Yes, these ones. But you should understand, the people that were offering sanitizers, almost, maybe I'll be right, but 75%, they can afford it on their own. Now let's go to Limbi, the government markets, Blantyre market, where the city council gets rates every day. They get money from people driving in, someone with a business. They have to pay for that, but they're not providing any masks. They're not providing any sanitizers. Where is our focus? Because where is it prone enough? Because if you're walking in ShopRite, if you're closer to someone, they'll be like, hey chief, hey, come, But you're making sure that these people in this ShopRite, they're really safe. Already they know they need to be safe. But go to Branda Market, these guys don't even have a proper toilet. They can't even have water,
Running
so that's why I'm saying that our focus is not where it's supposed to be. If we get
we
it
have
right,
like so much work to do before we even get to the COVID issues, like sanitary wise.
And if before we get to, like she said, public heard, before we get to public, can we go to specifics? The way we're saying essential goods, let's also go to essentials now. Let's go back. Okay.
Like because like an average Malawian can only afford soap to bathe with. Now you're telling them could you use it to wash your hands at least 10 times a day. Does that make any sense?
They use the same to bath, to even use it as a lotion.
Yeah.
To wash.
And so also the dishes, probably.
Yeah. Literally, that's what I'm saying, that we have to
I laugh, but this is a reality.
Yeah, it is. So we have to tailor-make everything. Yeah? People are laughing, Trump is having people demonstrating why they shouldn't be wearing masks. That's their reality. They had to deal with their way.
Let's do it.
We can't do it the way we did. South Africa did it. They messed up. Sorry to say this, but they messed up. They just copied everything, and then boom. They said no alcohol, no what. I had a doctor doing an interview and said, we're dealing with gunshot wounds, violence-related patients than COVID itself. Because people are not drinking in bars. The issues
Just
in Malawi.
mental health.
Yeah, in Malawi, you're looking at the rise in numbers of pregnancies in young people.
Students.
True.
Students.
Like
in
in
Mangochi.
Because
Mangochi,
we didn't think what it would mean when we closed the schools.
Yeah.
So,
Did we even give the girls an alternative to going to school?
What
Instead of going
happened?
to school, you can do this instead. There was nothing.
So my
We
point
just-
is, like she said, we have to put a right focus on the right place. Once we do that, a lot of these issues are why we're arguing and always debating about won't make even valid points. The reason why we're saying, President, you said we should be social distancing, but look at
you
the
did this.
funeral.
Yeah.
My auntie Ru was buried when she was dead in the morning. She was buried in the afternoon by guys in white suits. But what is happening
what
to
is
you?
happening now?
You know why we're doing that is because we haven't fully understood what we're doing. So once we do that,
It should be proper comprehension. Yeah. Akulu, any last words?
This was fun. Okay, my last thing, because I never got to say my lifestyle changed. My life hasn't really changed, but it has felt like the world is at a sort of standstill at the moment, and that's given me a relief. Because it's like, okay, now I have like more time to figure out
or procrastinate.
Yeah, no, man, no, not procrastinate, but like figure out, because I feel like I need a lot of time to figure out my craft. So it's like, oh, okay, now I'm at home like everybody else, so it's not like I'm doing something weird. It's fine.
Yeah.
I can, I'm not being judged by anyone now. It's fine.
Yeah.
So, but otherwise, yeah, this was fun.
Yeah.
Great.
Yeah, just thanks for having me here. I think we've said a lot of things.
We have.
So, yeah, thank you.
Yeah, and you want to say something?
No.
Okay.
and
This
just to
is
say we're not always right.
yeah.
And this is my
This
opinion.
is my opinion.
Personal opinions over here.
Personal opinion.
Just because
Yeah.
I know some people like, who you do this?
Yeah,
for?
yeah.
You know it all. No.
Yeah.
You
I've
put
just-
your mask on the text
Yeah.
on the table.
I've just been given an opportunity
Yeah.
to say what I think.
Yeah.
And that's it.
All right, guys, this has been a very lively conversation. I've had so much fun, and it's been very insightful, like very different opposing opinions and everything, which are very thought-provoking. So I have been Zara with Lusayo, Prince, Akulu, and Mihawa, and thank you for listening to this podcast.
Andrew, actually.
Yeah,
I call him Mihawa. Mihawa styles.
Mihawa. It's my name.